Hello friends, welcome again, and today we are going to discuss another subject which I hope many of us must be thinking that it is me, and the subject is do you guarantee yourself that your memory is intact? Have you ever sit and try to analyze that where my memory is? Not necessarily you need to be 80-year-old to start analyzing, because by that time it is too late. But when we talk about memory, what exactly memory is? Means on a normal circumstances, if we talk about that your short-term memory, long-term memory, analyzing the things, storing the information, able to recall, concentration. These are the simple day-to-day happenings which happen for all of us, and we don't even realize that my memory is start getting a little bit compromised. And when I realize, by that time it is too late, because then it come to the stage where you will be termed by our medical system, it is not reversible now, and you are moving towards dementia, Alzheimer's or other kind of cognitive disorders. Now question is why this happen and what we can do to protect it. On a day-to-day basis, it is essential that when you are using something, and if we don't look after it, it will definitely get affected. And that's our biggest dilemma is in human body and human nature, right? That we try to look after whatever belongs to me in the form of my assets. Even if you have a car, whether costly or not costly, you take it on a regular basis to your mechanic to get the warrant of fitness for your car, right? And then if you have your very nice shoes, you would like to polish them when you want to wear, so that everyone can praise you. You want to look clean, that's why you have a shower. But then no one wants to see that, okay, if I'm using my body, what is body? Body is a machine, we all understand that. And now if we don't look after that machine, why we think it is naturally given me a guarantee that I will never have any wear and tear. And this is what one science which we talk about, Ayurveda, help us to understand that we must look after every part of our body. And today we are going to talk about memory, which relate with the brain function from our Western perspective, even from the Ayurvedic physiology, even though in Ayurveda we go a little bit more beyond that how the brain can get affected. But I'm not going to focus too much on Ayurvedic concept, because this is my discussion for everyone. Everyone means every individual, everyone in the community who can suffer from this simple or serious issue of memory loss, or memory is on decline, right? And then also to all kind of practitioner, not only Ayurvedic practitioner, but medical doctors, naturopaths, or other kind of practitioners who don't want to associate with Ayurveda, Hence, I'm not going to focus too much on Ayurveda, but then at least I hope some of them must be having a conscious practice where their focus will be, apart from making money out of this profession, they also have the desire to help their client in a right way. So that is where the message is for anyone who is able to listen to this talk. Now when this alarm start ringing that something is going wrong with my memory, then we try to ask our practitioners, GP, that what I can do. And then they will be advising that yes, you can go for taking various kind of supplement. And supplement, what are the supplements? Let's have a discussion on that first. That we are always advised about omega-3 fatty acid, fish oil, because we make our client understand that fish is very, very important component, and that is what you get these all from the fish, and hence you need to use this omega-3 sort of supplement. But if we try to make stats and analyze everyone who is suffering from memory loss, dementia, Alzheimer, throughout their life they have been eating fish every day, if not every meal. Then how come if fish oil and omega-3 is the requirement for an individual to maintain their memory, why those people are having all these problems of Alzheimer's and dementia? Then we also advise them that creatinine is one component which is an amino acid which can be in our brain cells and in our muscle cells, and which can get affected, right? And it very well established, it will always get affected due to our erratic lifestyle, and or even with some kind of injuries. But then it comes up straight away to that part that if one is not looking after them, this can naturally get affected. Then many of us will be advised that you need to get into caffeine. And again, if you look at anyone who is losing their memory or suffering from dementia or Alzheimer, throughout their life they have been drinking coffee all the time. So how come, if coffee was supposed to be good for my brain function and for my concentration and memory, why those people are the one who are suffering from? Then there are so many other kind of supplement, like mushroom is another one which get advised by many practitioners, right? Whether it is loin mushroom or the other kind of mushroom, because they have another amino acid which is L-theanine, right? And then there are various vitamin B complex part is coming up. Then vitamin D is another aspect which come to all of us as a natural part. So various supplement out in the market, which every individual starts using them in their life at one stage, whenever they, especially either if they get 40 or so, and even the magnesiums and other kind of supplement, everyone will be using them. But in spite of that, they ultimately can come and hit to that stage where it can be termed that one is losing their memory and they are now on toward the dementia or Alzheimer's. And reason of me talking about these two major cognitive disorders, that recent stats has come up that in Australia and New Zealand, Alzheimer is becoming one of the highest affected ailment after cancer. And it is something alarming. And then we know in our Western medicine, there is no solution for, apart from these kind of vitamin B complex or B12, B6, and then all the other component which I just mentioned, to advise to the client, right, and start taking. But then question is, has there anyone seen that by taking these supplements one can reverse dementia or Alzheimer? And that's where our Western medicine will come up. They will say, no, once you have that, you have to live with it, and it's a progressive disorder, and you cannot reverse. Fair enough. But then, again coming back to Ayurveda, Ayurvedic science, which is around with us for last 5,000 years ago, even though many are not very keen to talk about it very much, and the public still not very much aware of that, because again, even though many practitioners out, whether they are medical doctor, whether they are functional medicine practitioner, integrated medicine practitioner, or even naturopaths or herbalists, they would like to use Ayurvedic principle in their practice, but they won't talk about that, what exactly Ayurvedic science is and how it works. And one component which we always talk about, that Ayurvedic science is that science which enhance awareness of every individual, that how they can live with awareness so that they can prevent and protect themselves from having a various kind of ailment. This message is very direct to the public also, and to those practitioners, that let's come, and now time is coming up, that rather than you wasting your money on so-called supplement for enhancing and protecting your memory, one need to look at how my memory can be supported. Because I'm not asking you to wait for the memory loss to happen, but how one can work out and do certain things which can be helpful to protect your memory and not let that damage come to that stage where your specialist has to give you in writing that it is not a reversible issue now and you have to live with it. You can have a very good memory and remember every moment that when I'm moving on the last day towards the graveyard, I can remember everyone around me. That is what life need to be, rather than be in the bed and not even recognizing your son, grandsons and children around you. So on that note, what can be done? Very simple is, we need to get out of this concept of that these kind of supplement can help. But at the same time, yes, there are Ayurvedic herbs which help and protect you by using them on a regular basis in right amount of the dosages of those herbs, right? Earlier than being a too late sort of scenario. Reason why I am sharing this with you, because those herbs are corrective action rather than supplementation. Time is now gone that you need to pick up for every ailment a supplement. Supplement means you are asking, you are passing on a direct message to that part of the body that you need not to worry, you don't need to function. Here is the supplement which can do the job for you. But then what happened? That particular part of the brain, particular part, organ of your body will ultimately die. When you are not using it, what will happen? It's a common sense. That's what we need to ask ourselves. This is our body. You are trying to look after yourself. You are spending your money. If your doctors, your practitioner is advising you something, you must question. Or even if you are going and picking up from your shelf in the health shops, you need to ask yourself, is it something has done any good to me? Don't get into that placebo effect aspect and kind of thing, and then by the time when damage is already done, you have to say that it was a God will and I have to live with it. That's not the way. That is where Ayurveda comes up and talk about. And in Ayurvedic aspect, there are 3 bodily intelligence which are working in our brain, which has a great role to keep the function of our brain in regard to the memory, whether it's short-term memory, whether it is long-term, whether it is analytic, analyzing, judgment, all that part. Those all cognitive disorders, what we call as, these are the cognitive function which are governed by these 3 intelligence. So those kind of herbs can be used. Now, these herbs has been around with us thousands of years ago, and they have been well used by Ayurvedic practitioners. But then what the myth and what the question mark always get raised towards Ayurvedic herbs, that there is no scientific studies against them, there is no test done for them, there is no proofs about them, and then they will always question that Ayurvedic herbs are always not good quality, they are adulterated, because we always question anything coming from India that these will be adulterated. Then the heavy metal is one big thing which medical doctor, functional medicine practitioner, and even the naturopaths always question that. And that's where I will be sharing with you. Again, as I said, focus is our life. Focus is public's life. That if such problems can happen to them, how we can guide them, and rather than passing on wrong kind of information. And that is the reason now these herbs which I am talking today are all being now well researched in the labs, which give satisfaction to all kind of practitioner. All the test has been done, right? Even though predominant tests are still all over the world are done in the labs where it has to be done on the animals, but there are many tests which are getting into the clinical blind, what we call a double fold test and all that part, and that these herbs has been proven to be very effective in those kind of cognitive disorders. So one of them is Brahmi, Bacopium anoria, which is one of the best herb known for all kind of problems, even simple anxieties, worries, panic attacks, sleep issues, which ultimately are the core cause behind starting the cognitive disorders. Now, but question is how this herb works. From Ayurvedic perspective, as I said, I'm not going to touch that what dosha it will balance, because that is not something we want to hear, or neither the public will be able to know. That is where it goes on that what is the active constituent of this and how it works. So when we talk about Brahmi, its chemical composition is dominated with the alkaloids, flavonoids, glycosides, saponin, and then the one major active constituent which is from the Brahmi which work for this cognitive disorder is bacoside A and B. Now when these things are looked into, that then it get that how it actually work. Now in Alzheimer's disease we understand that it is a connection between the cells get lost, and that's where the messaging start getting affected, which we call as neurotransmission. Imbalances happen and destruction happen. So for that kind of imbalances and pathologies, Brahmi is one of the best herb to do that repair work, and it also bring in for concentration, right? And then it's another saponin is out of it is known as triterpamide, right? Which is again very specific as a more with the repair work part to do. So even if we have to rely on the chemical composition of the herb, it has been very well established that Brahmi is one, Bicopia is one such herb which has the ability to do the repair work. So saying so that once you suffer, you don't need to, or you don't have the ability, you have to live with it, there is no reversal. So, but if you are able to pick up the problem in the early stages, or even if you feel that due to whatever reason of my lifestyle, I need to look after my brain, where the memory function is the one important component, we can start using these kind of herbs. And another thing which all of us need to understand, that Ayurvedic herbs will work with the synergy of the herbs. So what that means is, rather than using one herb, Ayurvedic science, Ayurvedic practitioner able to give you that what are the different herbs which can be combined together to get the best outcome. And then on top of that is that what are the dosages. Now it is very well established that Brahmi, which is best herb for the neurotransmitter issues to get into more stability, have the repair work role to do and help us to prevent the cognitive disorders happening. It will work only when you are using 2 grams in a one single dose, not less than that part. That is why this herb has been very well used in ancient time, whether it is for Parkinson, concentration and all that aspect. Then there is another herb which is very, very effective for these kind of disorders. We call it as centella, and which is Mandukaparni is a Sanskrit name. Again, if we look at its active constituent, it has a saponin and triterpenoids and 2 main chemical constituents which relate with the centella, and they are the one who work for cognitive disorder. One is known as a brahmoside and another one is a brahnioside. So these are the 2 active constituents, and they act as a stimulant for nervine function. That's why it is known as a best nervine tonic, rejuvenator. It also has a calming effect. That is why it carries the anxiolytic activities which relate with the anxieties and all that part. It also has an antidepressant quality, anti-epileptic quality it also has, right? And that is why it is known as the best antioxidant for brain function, and then again with the cognitive disorder. The centella acetica is known for revitalizing the brain function and helping more and more concentration. So that's what you can also rely on this one herb. And again, if you see, all these researches has been done in the lab. I'm not talking from the Ayurvedic text where our focus goes on the how it balances various doshas, and then because each of those biological humor have their specific role in the memory's function, right? So hence we can select, but I'm just giving you at least 3 of the main Ayurvedic nervine herbs which has been very well researched and very well used, right? And again, if you look at all the researches which has come in the last 10 years for this herb, because this is one of the herb which get used in our Western herbalism, and all those, if somehow this message can go to those people who are into manufacturing of various kind of supplement, and you can see many Western herbalism supplements are coming up in the market where they are using centella, whether they are using Brahmi in some. But one thing you will, or one thing you should be careful is about the dosages. No such products so far in the market, whether in Australia or in the USA or other countries or even Germany, where these herbs are used more and more commonly in different kind of product, that has used in near to the even 2 grams of that. And then the centella is another one which is need to be used for 2 grams as a single dose. Then there is another herb known as Benecassa hispidea, which is known for its essential nutrient component and known for its versatile impact on the various bodily function, but in the neuroprotective action, it is known for restoring the memory. That is what it is. And on a natural basis, it has vitamin thiamine and riboflavin, and it has sodium, potassium, magnesium, phosphorus, calcium, amino acids. Right? So on that basis, it works wonderful as a protective herb in regard to the nerves function. And if our nerve function, which we are talking about, the cognitive disorders, are getting set, which can be picked up. It's not that you have to wait till late stage to be term and understand that these are the problems now already done. They can be picked up in the early stages, and then one can help to get into using right kind of herbs. So these 3 herbs, and again you will find this is one of the herb, again has been very well established in the labs, that need to be used 2 grams. So my request through this message is to those people who spend hundreds and thousands of dollars every year on different kind of product for restoring their memory and not able to get anywhere. I will advise them that even if you can do it for 6 months and use these 3 herbs. And now how you can use these 3 herbs? These 3 herbs, you don't need to worry to take up a powder and then worry about their qualities and then all the heavy metals and adulteration kind of aspect. I'm going to show you one very specific product, has been established now by Ayurvedic company. This product is, yes, definitely marketed by myself and has been made by my company, but this product is made in Australia and it has a TGA license number. So ARTG product is that. So what that means is quality control, all the testings are done by a TGA approved GMP certified company. Nothing to do with me or anyone. My role was to put the formulation together and given to them, and that's what they manufacture. But then if someone is keen to use any memory related product and they feel that we are having a memory loss, or some of my family member is getting into this, memory sport is a product which you can use. Now why you should use that? Look at the ingredients here. If you see the ingredients, Bicopia menorrhea is 2.2 in a 1 single capsule. Then you have your centella, which is 2 grams in a 1 single dose. And then I mentioned about Benecassa hispidea. It has 2.6 grams in a single dose. So that becomes your best potent product for your memory issues. And that is what these Ayurvedic products are now out in the market for various imbalances. But because we are talking about the memory sport and memory loss, so that's what the product one should use. And again, as I said, here I'm not only to advocate for the sale of this product. I'm here to provide the education to anyone, not limited to the Ayurvedic practitioner. And that's why I would like to make an appeal. If anyone is listening this talk and they are interested to have a more discussion that how these herbs work based on the chemical composition, and also giving you some clinical evidence that how the clinical trial has been done and what are the outcome, what is their position was in the early stages when it gets started and how the outcome has come up. I'm more than happy to have open webinars with anyone, and even if someone want to have a one-to-one discussion on these products, because what I'm sharing is not something which I'm making up myself, but these are now very well established about these herbs. You can search on all the various research platforms and the journal which can give you the information. But even someone still want to have a discussion. I live in New Zealand, but my business, my college is in Australia, in Brisbane, Consultation Institute of Ayurvedic Studies. We also have our Ayurvedic store where we have these kind of products available. So you can always call me. My number is 021913625. You can email me, Dr. Ajit at planetayurveda.co.nz, and I'm open to all these discussions, so that as long as you have one simple objective, that you want to help your client, you want to support them in right way, you are supporting in a conscious practice where we all can together help our client. And then those people who have somehow associated through their clinic and like that, if they can pass on this message, this video to the ultimate community, public, because it's the public who suffer from these problems, so that will be very helpful. And I'm always available for any other discussions if a client even call me, and I'm happy to support them. So thanks everyone for listening to this message, and hope we will come next time with other aspects.